Hi everyone, so today we're gonna share about the mountain adventures. Climber clearance requirements. This is period 1, table 9. Clients are Wes and Kay. And this presentation is presented by Jack Ho, Yiren Wang, Philip, and Bayliee. So first of all, we're gonna start with the data analysis of Wes. Wes is a 38-year-old male with high cholesterol and a family history of early heart attacks. His blood work shows total cholesterol of 261 mg over dl. LDL is 189 mg over dl and HDL 42 mg over dl, which increases cardiovascular risk. His resting heart rate is about 98 beats per minute, and blood pressure is at 130 over 85 mmHg. His ABI is 0.6, suggesting reduced blood flow and possible peripheral artery disease. Respiratory data shows FEV1 over FVC of 67%, and which may indicate obstructive lung issues, and pulse oximetry is 94%, which is slightly low. The total red blood cells count is normal at 5.2 times 10 to the power of 6 cells over MCL. And next, I'm gonna share about the clearance stages and reasoning. Wes should not be cleared for the climb because his data suggest increased cardiovascular and respiratory risk. His very high LDL and total cholesterol, combined with a family history of early heart attacks, raise concern of heart disease. His ABI of 0.6 suggests poor circulation, which could make intense hiking unsafe. In addition, his FEV1 over FVC ratio of 67% and oxygen saturation of 94% show reduced respiratory function, which may worsen at higher elevation where oxygen is lower, because mountain climbing places extra stress on both the heart and lungs. Clearing him now could put him at risk for serious complications.
Potential risks and diseases of climbing. Based on Wes conditions, climbing may trigger the onset of some potential diseases due to high altitude, including extreme fatigue, dizziness, shortness of breath, chest pain, heart attack, and even more serious, sudden cardiac death. Our recommendations. Wes should first see a health provider for further cardiovascular and pulmonary evaluation before attempting any mountain climbing. He may need follow-up testing such as a stress test, further lung function test, and a treatment for cholesterol and circulation problems. He should improve conditioning gradually, monitor oxygen levels with exercise, and avoid high-altitude climbing until medically cleared.
This is our data analysis on Kay. Kay is a 47-year-old woman that has a history of being a smoker. Her lung volumes show her TLC is 4.95 liters, meaning that it's well below the normal capacity being 6 liters. Her FVC is within the average range, but her FEV1 rate is 1.9 liters, which is also well below the average. Her FEV1 over FVC ratio percentage is extremely below the normal threshold, sitting at 47%, while the normal rates are usually around 70 to 85%. This indicates that she has severe obstruction. It's also seen that her PEF is 540 liters per minute, while the average is generally 300 to 500. Her pulse ox is abnormal, and based off her EKG, it's demonstrated that she has sinus tachycardia as well as sinus arrhythmia. So at this point, regarding Kay's clearance, we recommend that Kay should avoid climbing any trails at this point of her health. She has multiple issues in both her cardiovascular and respiratory system, which needs to be prioritized before climbing the mountain. All of the data collected point to Kay having clogged arteries and respiratory tract, proven by her sinus tachycardia and lower ratings in her spirometer, meaning that her body isn't getting enough oxygen at an altitude that has the most abundant amount. So it's certain that she wouldn't be able to breathe at a higher elevation, hence leading to our decision of having her avoid any extreme activity, especially mountain climbing.
Potential risks and diseases of climbing. Based on case conditions, climbing the mountain would trigger high-altitude pulmonary edema, which is a disease where fluid fills the alveoli, air sacs in the lung, which cause fatigue, dizziness, shortness of breath, chest pain, heart attack, or even in more serious cases, cardiac arrest. Our recommendation for Kay would be to first visit a pulmonologist to get medication for her clogged airways, which will improve her ability to do physical activity, as well as to see a cardiologist to get further treatment for her PAD, or peripheral artery disease, and medication for sinus arrhythmia and tachycardia. Other recommendations that would give Kay the ability to hike later on would be to exercise cardiovascularly with the aims to improve circulation of oxygen throughout the body. Respiratory muscle training, such as diaphragm breathing, to strengthen the muscles responsible for breathing and exhaling, which would bring up her spirometer data, as well as improving her diet to drop her HDL and cholesterol levels and increase her HDL levels, and prevent smoking. All of this would help with PAD and other heart conditions. Additionally, we would recommend Kate to do respiratory and cardiovascular therapy. As her vitals return to a normal range, then she could consider hiking the trails, where she would still have to do aerobic-based training for the higher altitudes.
And that's all for today. Thank you for listening.